Good morning, doctor. My name is Lindjie from Philcare Pharma, a Filipino-owned company that specializes in anesthesia, anti-infectives, and critical care. I'm here to introduce to you a new pathway in the management of MRSA, which is teicoplanin. Our brand is Imtec. Imtec comes in 400 milligrams of lyophilized powder for injection with 1.5 ml ampule with steroid powder injection. And it is indicated for the treatment of MRSA management and serious gram-positive bacteria. And according to CDC or Center for Disease Control Prevention and Management, that there is a serious problem that we are now encountering worldwide. So according to Alexander Fleming, who discovered the first antibiotics, which is penicillin, he then discovered that there is a problem with the resistance of antibiotics, and as well as MDROs. And to give you more background, methicillin-resistant Staphylococcus aureus, or MRSA, is a kind of MDRO, which is a bacteria that causes infections in all parts of the body. And in all parts of the body. And by the way, doctor, for the first time in the Philippines, I would like to introduce to you a teicoplanin drug, which is Imtec, that can address all those problems with regards to antibiotics resistance. And it is indicated for children, over 1 month old and adults, for the treatment of gram-positive infections. And it is given via intramuscularly or intravenously. And for the intravenous administration, it can also be given via bolus or a 30-minute infusion. And by the way, doctor, teicoplanin can also be given by various indications like bacteremia and Clostridium difficile associated with colitis and diarrhea. And doctor, hence the mechanism of action of teicoplanin is to inhibit the growth of cell wall synthesis. And they found out that teicoplanin is a better alternative than vancomycin, and vancomycin has a side effects of doesn't have a good side effects. According to the study of Svetitsky et al., which is a comparative study between the efficacy and safety, they found out that there is no significant mortality with teicoplanin as compared with vancomycin. And another clinical study, which is according to Harding et al., JAC volume number 12, it is a comparative pharmacokinetic study which makes it more efficient and convenient to use. Thus, it is a cost-effective treatment for the patients with MRSA and gram-positive infections. And in the elderly patients, with moderate infections such as SSTI or soft and skin tissue infections, it can be given via IM or IV with a minimum loading dose of 6 milligrams per kilograms, followed by BID or given twice daily for the first 3 administrations. And the maintenance dose is 6 milligrams per kilogram given once a day via IM or IV. And reminder, doctor, that for the neonates, only the infusion method can be administered to the neonates patients. And doctor, for the patients for the elderly patients with severe infections such as bone and joint infections, septicemia. The loading dose is 10 milligrams per kilogram body weight, which can be given 12 hours apart for the first three administrations. And for the children with or neonates, the loading dose is 16 milligram per kilogram, following 8 milligrams per kilogram body weight given once daily. And for the renal insufficiency patients, the adjustment reduction is not affected given on the fourth day of the complement treatment. And for the patients with moderate renal insufficiency, the the loading dose is still 6 milligrams per kilogram body weight, and it can also be given via IM or IV administration. And for patients with severe or mild to moderate renal insufficiency with creatinine clearance of between 40 to 60 ml per minute, the dose cannot be adjusted. And Doctor, to summarize what I have discussed with you, DSM Imtec is a better alternative over vancomycin. It has no Redman syndrome, no nephrotoxicity, and it can also be combined with other medicines. And the price, the catalog price is 1,950 pesos per vial. And Doctor, to give you more confidence in giving our DSM Imtec to your next 2 to 3 patients, Doctor, I would like to emphasize that it is a WHO GMP certified and FDA certified here in the Philippines, and it also passed the bioassay and CEDRES. And Doctor, with that, I hope you are now confident in giving the DSM Imtec to your next patients. And thank you, Doctor, for your time.